Now, there's more evidence this morning that millions of people who take high doses of two commonly used painkillers over a prolonged period of time may face a slightly increased risk of a heart attack.
Ibuprofen and Diclofenac are often taken to help relieve the symptoms of severe arthritis. Well, researchers at the University of Oxford say that they hope their latest findings will help people make informed choices about what medication to use.
GP Dr. Barbara Murray is here now, and it's just, can you establish what products we're talking about here?
We're talking about mainly the two most common used anti-inflammatory, ibuprofen, which people buy over the counter, and diclofenac, which usually you would get from your doctor.
Okay, and the kind of risk we're talking about and the usage that would be relevant?
We're talking about the risk to people who primarily already have an increased risk of heart disease. They are most at risk, and only at risk if they're taking high doses of these anti-inflammatory forms of medication for a prolonged period of time. So we're not talking about people who have an acute bad back and have to go to the chemist to get some ibuprofen, or have sprained their ankle and they have to take an anti-inflammatory medication for a few days. We're not talking about people who are needing it for the short term. It's people with, for example, say rheumatoid arthritis, chronic long-term conditions who need some form of anti-inflammatory medication. But the advice really hasn't changed that much. It's a very important study because it enables us to be a little bit more vigilant as to who we select for long-term medication. And we'll have a look at them a little bit more closely to see what their risks are of heart disease.
This is the concern, though, isn't it? That anyone who's hearing this, who perhaps is a long-term user of ibuprofen or diclofenac, the assumption would be that their GP is on top of this or monitoring their progress anyway, isn't it?
We would always advise people, but my advice is always only take the minimum amount for the shortest period of time. Certainly in the elderly, we haven't been prescribing anti-inflammatory medication, apart from acute situations, for a long time because of the risk of gastric bleeding. So this is just an added risk that makes us a little bit more aware of who to select for the long term. It's always a balance of risk versus benefit in every form of medication.
And you referenced that a moment ago, but are there many people who are on long-term, using these drugs long-term?
There will be quite a few people who we already know about who are taking long-term anti-inflammatory medication, but those people, because we already know about them, we're already onto them, if you see what I mean. We check them regularly. We check them from the point of view of the gastrointestinal problems, apart from the cardiovascular.
So should they, though, generally be thinking of alternative treatments? If say you have rheumatoid arthritis, generally the prognosis is that it worsens over time. So you have to think of something else then to be able to treat this.
But we already do that because we try to avoid the anti-inflammatory medication, as I said previously, because of the gastric problems. So this just really enhances that advice. There will be some people who cannot manage without the high-dose, long-term anti-inflammatory medication. And those people need to be reassured that we will make sure that we're minimising the risks as far as possible.
OK, Dr. Murray, thank you very much.
Thank you.
Let's see time now. It's just come at 7:15.